You can take as much time as you want to read. There are 2-3 slides. In exam, definitely you will be given 9 minutes. Once you have done reading this, then tell me, I'll do next.
Yes, ma'am.
Yes?
Yes, ma'am. Yes, ma'am.
Right.
Yes, ma'am.
Okay, good.
Ma'am, can we go back to the first page? I need to know the name of it.
Right.
I'm not sure the name.
Linda Roberts.
Linda Roberts gift. Okay, yes, ma'am.
Okay, so if both of you have read and understood, considering the communication skills station, I'm starting the timer. Begin, please.
Hello. Good afternoon, Mrs. Linda Roberts.
Good afternoon, doctor.
I'm Dr. Shahid here. I'm one of the surgical doctors here. I was asked that you wanted to speak to me about something today.
Oh yes. I want to go home.
Sure, Mrs. Linda. Let me just explain to you your condition. I don't know if you're aware of your condition as that. We have diagnosed you to have acute pancreatitis. What this means is basically you have certain amount of inflammation around the organ called pancreas. This organ is situated in the upper part of your tummy, because of which you have had the abdominal pain and you have had vomiting episodes as well. The probable cause for this is probably intake of an alcohol, almost half a bottle of alcohol per day you have been taking over the past few days. So this could be attributed to one of the causes of this. However, a situation of an acute pancreatitis, or the inflammation of the pancreas as we call, can be very serious, and hence you have not been allowed to take anything through the mouth, and we are giving you IV fluids and IV painkillers. This is the situation to be explaining in normal terms, and we would strongly recommend that you stay in the hospital for further treatment of this situation.
I have all these tubes on me, you keep pricking me to take samples, you just walk, I can't walk around, I can't take my alcohol, I need to take something.
I'm extremely sorry. I'm extremely sorry.
I'm tired of this place. I'm so tired. I just want to go home.
Really very
it's
sorry.
boring here.
I'm extremely sorry. I'm extremely sorry, Mrs. Linda. I do understand your concerns, and I completely agree with you. It's a very boring place, but you would not be kept in the hospital unless it is absolutely necessary. And given your condition, I understand that all these tubes are very cumbersome, are very problematic. Still, I would recommend these tubes be in place, and you take best medical treatment here. As going home, things may complicate further, and you may not be able to get the best medical health checkup as is there.
So, doctor, when am I going to go home?
This is difficult for us to tell right now, madam. But what I can certainly tell you is we'll keep a close eye on you. We'll give you the best medications possible and treat as per the best protocols available. And as soon as you're fit to discharge, I myself will come and inform you.
Okay, so what about I need to have something to drink, you know? I've not had something to drink in a long time and I'm tired. I need to drink something.
Right, madam. Basically, what we're trying to do is we're trying to give some rest to your pancreas. Whenever you eat through your mouth or drink through your mouth, this goes down to your tummy via the stomach and it stimulates the pancreas. So what we have been trying to do right now is give rest to your pancreas by keeping you nil by mouth. And then what I'm planning of doing is we'll make sure that your weakness and your tiredness will be alleviated by giving IV fluids, and your pain will be subsided by giving some medications which you can control by your own self. Will that be okay, madam?
Yeah, it's fine. It's fine. I also need to go home because I have to see my family and all that. So is there anything you can do for me about that?
Most certainly, madam. I do understand the need to meet your family, but right now I think the priority is your health. And once you're okay, you can go visit your family and take care of them in a much better way than in this situation. What I can do is I can actually ask a social worker to look out for your family while you are here admitted in the hospital. Will that be okay with you?
Yeah, that's fine. That's fine. That's fine.
Sure, madam. So what I can do right now is let me just summarize your case. You have something what we call as acute pancreatitis, and you have been admitted here in the hospital. You're not been allowed to take anything orally, and you have been giving IV fluids for the nutrition and for rehydration purposes. Also, you have been given some pain medications which you can control by yourself. Other than that, you seem to be doing okay, but we need to monitor you further closely and take care of you further. Is that correct? Have you understood it till now?
Yes, I understand. I understand. Also,
do you have any questions? Any other queries? Any worries that you need to tell to me? I'm here to listen.
Okay. I'm just wondering what you could do for me about this, the hospital environment and how boring it is here. Is there anything you can help me to improve the environment?
You wouldn't be kept in the situation unless it was absolutely necessary, ma'am. What we can do best is we can try to treat you as soon as possible, and hopefully, if you treat well, possibly as soon as possible, try to discharge you. Should that be okay?
All right. No, that's fine. Thank you.
All right. I'll do one
ask for the sign for the Dama form. Patient would go home.
Okay.
In the situation
indemnity form, you have to.
Okay, so I would like to go home because this place is boring and I'm tired of the environment and I just need to go home.
Okay, in this situation, can you please, is it possible for you to tell me back everything what we have just spoken so that I confirm that you understand?
Yes, you told me that I have the pain I have in my tummy is because of an organ inside that is that's swollen because of the alcohol I drink. And then you also told me that the drugs that the lines on my body and the drugs that's going in is to relieve my pain, and then you are not allowing me to eat or drink anything because you want to rest that organ. So then you're observing me for now. So there's no problem, but I still want to go home. I think I'll be fine when I'm at home with my family and my cat.
Sure, Mrs. Linda. The thing is, I cannot discharge you medically, and hence, if you would like to leave now, you would have to sign a form for the discharge against medical advice, and which clearly states the condition of your health and also states the complications if you wish to discharge against the advice, and that you will be responsible for the further consequences of the situation.
Good.
Okay. So can you tell me about those complications you?
You may feel drowsy, and there may be a drop in your blood pressures. Secondary to this, you may also develop other organ failures as well. Along with this, you may have multiple episodes of vomiting and severe abdominal pain.
Okay, thank you. I think I'll handle that. Thank you.
Okay, then I would request you to sign the discharge against medical advice form, the indemnity form for this.
Thank you. No problem. Can I have it?
Yes.
Okay. In a
Good.
situation
Now-
that
Yeah.
in a situation that any of your, if you feel very weak, or if you have any severe pain in the upper abdomen, I will request you to immediately come back to the accident and emergency department immediately. Contact me or any of the SHO who is in charge there. Thank you, and I will leave my number with the nursing nurses so that they can get back to me anytime you feel like. Thank you, and have a nice day.
Very much. Yes, sir.
Okay. Yes, kindly give feedback, Dr. Dafar. Dr. Abbas, I'm sorry, sir.
Yes, ma'am. Thank you very much, ma'am.
Thank you.
Initially, yes, ma'am, he didn't confirm the age of the patient, even though the name and age of the patient was given in the vignette.
Yes.
I think it's good to say, I would like to confirm if you're this and
If
your age
you're
is this.
Linda, yes.
Yes,
45
if you're
years
Linda
old.
and your age is 45 years old, then you can then proceed.
I
And the other
can
thing,
confirm that. Yes.
Yes.
then the other thing is you should have told me, although you later asked, but the initial question from the protocol is to ask what the idea from the patient first before you go and tell him, okay, this is the knowledge I want to give you. Okay, well, this is what I think you have, so that at least the patient will express himself. Okay, I know I came with an abdominal pain, and then or a tummy pain, and then this and this is what has been done for me. Okay, then you tell him, okay, yes, that's true, you had this. However, this and this and this is what has been done, and these are the likely complications you could have. And I think maybe that was why you missed out on some of the complications while you were discussing with me earlier. Yes. So
yes.
Then I kept reminding you that I want to drink. I was hoping that you would talk about the possibility of social workers discussing with me about reducing my drinking, because that was what caused the pancreatitis in the first place.
Right. Sorry. I did mess that up. Yes.
Okay. Aside that, I think it's good. Thank you, ma'am.
Yeah. One thing was good that he was reassuring that you understand your competence. He was checking that he asked you to sum it back, but he has explained it to you. But like the complications that he explained at the end, they were not comprehensive. Dr. Dafar has also written in the chat.
Yes.
So there he had to be a little bit more comprehensive. And it should have explained little earlier when you were insisting to go home. So this is something, because Dama, no matter if it is spleen rupture or if it is acute pancreatitis, because this is like acute pancreatitis comes in history taking as well. So it comes in critical care as well. So this is something very common. So this is very common. You should be able to understand, and you should be able to give comprehensive guidance or feedback in it. So yeah, it was good. 2 or 3 things that you can easily improve. And always make sure to confirm the identity of the patient.
Yes, ma'am.
Good. Anyone else want to give feedback? No? Good.